The ruling All Progressives Congress in confusion as two leaders tussle over national chairmanship post. Federal government threatens action against the national resident doctors who began a nationwide strike on Monday. In international news, Indian soldiers reportedly killed in conflict with China over disputed border. In the sport, Bayern Munich celebrates 8th consecutive Bundesliga title despite empty stadium.
This is ANN News.
I am Olajumoke Olatunji. The ruling All Progressives Congress has declared its stance today for one of the two party leaders that have emerged as acting national chairman. One of them, Deputy National Secretary Victor Gaydom, declared himself as the party's acting national chairman. He says he's the rightful person to assume the office, but has also called for the cancellation of the screening exercise that led to the disqualification of Edo Governor Godwin Obaseki. He's recalling aspirants for fresh screening. But the party's National Working Committee has disowned Gaydom and affirmed the immediate past governor of Oyo State, Senator Abiola Ajimobi, as the party's acting national chairman. Ajimobi has been out of public glare for almost 2 months now. In a statement on Wednesday through his spokesman, Ajimobi called for stakeholders to, quote, continue to observe peace, end quote. The spokesperson says Ajimobi will soon call a meeting of the National Executive Council to resolve all contentious issues. The nationwide strike by resident doctors in the country's public hospitals continues. The National Association of Resident Doctors says the strike is to demand better benefits as the nation battles the coronavirus pandemic. Correspondent Kelechi Mekalam reports.
Resident doctors in Nigeria making good their threats to commence an indefinite strike. The strike follows the expiry of a 14-day ultimatum they had issued to authorities. The government and the medical union failed to agree on improved welfare terms for health workers.
Our demands are basic demands that borders on the health, the well-being and the abilities of doctors to offer care to Nigerians. As you are aware, the Nigerian doctors practicing at the moment are not having life insurance. What that means is that when a doctor dies, that's the end of it for his family. We are also demanding that personal protective equipment be made abundantly available in our hospitals so that we have a reduced chance of getting infected.
The National Association of Resident Doctors represent about 40% of doctors in Nigeria. With rising numbers of COVID-19 cases and deaths, many fear the strike action could hamper the nation's capacity to tackle the pandemic. But the union is making an exemption for medics treating COVID-19 patients.
We have exempted the isolation and treatment center. At the end of the 2 weeks grace we have given for the isolation and treatment center, we shall be co-opting our members from the isolation and treatment center to join the strike, and it shall continue till when the government feels it's necessary to address our concerns.
So far, 10 doctors have died of COVID-19, 227 others have been infected, and over 800 health workers are under a watch list of possible infections. Health workers' strikes aren't uncommon in Nigeria, where the health sector has remained underfunded. Many medics have left the country for greener pastures. There are rising concerns that this trend could further weaken the already fragile health sector.
The federal government is not amused about the doctor strike and is threatening action against any of those striking doctors who is on its payroll and does not show up for work today, Wednesday. The National Association of Resident Doctors says the striking doctors are demanding better benefits. An hours-long meeting among Labour Minister Chris Ngige, Health Minister Osage Ehanire, and the leadership of the Doctors Association deadlocked on Tuesday. Labour Minister Ngige said major issues have been worked out and that minor ones will also be resolved. Health Minister Dr. Ehanire Osage said the government would not allow hospitals to be fallow as the health of Nigerians is very important, especially in this time of COVID-19 pandemic. He said by 12 noon today, attendance book would be closed at all health facilities. He said those who report to work would be considered to still be in service. That sounds like those who fail to report would be considered to have given up their jobs. National President of the Doctors Association, Dr. Aliyu Sokumba, told newsmen the strike would only be called off if the government comes up with a tangible response to the demands. It appears the coronavirus pandemic has an upper hand in the country's fight against it. The Nigerian Center for Disease Control announced 490 new cases on Tuesday, bringing the total tally to more than 17,000. Lagos carried the lion's share of the infections as usual, recording 142 cases. Abuja followed with 60 and Bayelsa with 54. NCDC says 5,623 have been discharged. Kano State has released the autopsy reports on the mysterious deaths that took place in the state recently, more than half of which the federal government said were COVID-19 related. The figure from Kano's verbal autopsy report on the mysterious deaths contradicts the federal government's number. It says only about 16% of the mysterious deaths in the state were as a result of COVID-19. Governor Umar Abdullahi Ganduje said the report has put to rest other claims by those he said never wishes Kano well. He said the federal government's report did not pass basic validity and reliability tests.
Coming up, African news. Pets are being abandoned by owners in Egypt over COVID-19 fears. And later, international news. Indian soldiers reportedly killed in conflict with China over disputed border.
You are watching ANN.
Hey, tell them. They told me you are the best around here.
What can I do for you, sir?
I want my own very, very simple. I don't want any shine. If I see any shine.
Actually, I'd love some sequins on my skirt. And I don't like any frills. I beg, I want frills on mine. But it must not be too tight.
Tight! That tight now, that is what I want. And the transition.
Oh, you know what? I want a gown. Me too. I want to come to burn.
You know what GMS are doing this for coming? Hey, did you capture all the information?
Of course not.
Actually,
fantastic!
I give my customers what they love because everyone has their unique style. So why should they wear the same thing? Just like MTN for me, which gives unique data and recharge offers just the way you like it. Just dial *121# and turn up great offers every day.
Everywhere you go, MTN.
Welcome back. This is ANN News. South Africa has gone ahead of all sub-Saharan African countries in COVID-19 testing. It has now surpassed 1 million tests. Angela Coppola has the story.
The country's strategy has been to do mass testing to identify the true extent of the spread of the virus. But experts say using that approach poses a problem.
Mass testing is a good thing if you've got the resources to do it. But we don't. There is a shortage of test kits, not only in South Africa, all around the world, but we are competing with America, for example, for these test kits from a variety of different companies.
Health authorities are looking at other options, like contact tracing, until more test kits become available, especially in hotspots.
However, for places like the Western Cape, where we now have a surge in infections, I don't know if contact tracing is useful unless you can get those results within 24 hours.
Healthcare professionals are learning more about this new virus every day, and they say using only one approach to deal with the pandemic isn't the solution.
As a continent, as a country, we need to be very agile and very aware of the changing circumstances and be able to change in accordance with that.
That change in strategy was announced by the South African Health Minister recently. The country is now moving from mass testing to targeted testing in hotspots.
You're probably wasting a lot of tests on people who are negative. Now, by focusing on the hotspot, you are actually getting those people who are probably positive. So I think that is a changing strategy and probably a good one. However, even that, when you are in a situation where you have really constrained resources, it might still be better to reserve those tests for those that really need it.
While South Africa has crossed that million number mark in terms of testing, it's about managing resources and keeping that ammunition dry as we build up to that peak.
The fear of the new coronavirus is having a chilling effect on pets in Egypt. Owners have begun abandoning pets, some for fear of being infected by their animals. Adio El Marouki tells us more.
Nermin Sharif is spending some time outdoors with her golden retriever. She's been taking care of her dog since its birth. To this young lady, that canine is more like a child. But at the beginning of the pandemic, many thought pets could transmit the coronavirus to humans.
Because of these rumors, many people started letting go of their pets. So many dogs, some of the finest breeds, were put in shelters. Misinformation has caused catastrophe. I couldn't let go of her at all. I thought then that I would leave the house accompanied by my dog to keep my mom safe. I would lock myself with my pet, even if it's a risk to me. I wouldn't leave it.
To stay safe during the COVID-19 pandemic, Nermin knows she has to stay at home. But she couldn't deprive her canine from the vital time it needs to exercise and play. So as a precaution, after spending some time outside, she'd spray it with disinfectants before entering their home. Nermin's attachment to her pet has kept it safe.
But that was not the case for many other Egyptians. They're suspicious of getting infected from their pets, has made them release them into the streets, or at the best case, find a place for them in a shelter.
At the beginning of this pandemic, famous talk show hosts were warning people about getting infected with COVID-19 from house pets. The rumor spread very fast, and unfortunately, no one resorted to us vets to clarify if it is true. We had to move fast to counter this misinformation, because it was putting the lives of our innocent pets in jeopardy.
The biggest threat to house pets is releasing them into the streets. All their lives, they've relied on humans for food and drink. In the search for food along the harsh city streets, many house pets don't stand a chance against stray animals.
We noticed
a huge number of house pets and cats and dogs in the streets.
This was widespread. People would pick them up and bring them to us as soon as they can. House pets cannot survive in the streets. They will suffer from severe dehydration, and usually they don't survive for more than a week.
Animal rights groups and shelter owners are saying the trend is starting to fade away as Egyptians start to get used to life under the pandemic.
Algeria has announced the lifting of lockdowns in 19 provinces and the easing of measures in 29 other provinces as COVID-19 dwindles all over the country. The government says people are going on with their lives and the businesses have been allowed to reopen. Public transport has also resumed operations, but under COVID-19 safety measures that include limited number of passengers. Taxi drivers can only pick up one passenger at a time. The government laments the residents of Nama in the south of the country are not respecting security measures. They are said to ignore social distancing and are wearing no face masks.
When we return, international news. Indian soldiers reportedly killed in conflict with China over disputed border. And later, sport. Bayern Munich celebrates 8th consecutive Bundesliga title.
watching
Welcome back. This is ANN News. 6 American states, Arizona, Florida, Oklahoma, Oregon, Texas, and Nevada, who relaxed COVID-19 measures and reopened 2 weeks ago, have all recorded for those 2 consecutive weeks a high number of COVID-19 infections. Health officials in many states have attributed the spike to business reopening and Memorial Day weekend gatherings in late May. Health officials in Oregon are trying to contain more than 200 new cases in Union County linked to a church where service was held without physical distancing measures. But Texas Governor Greg Abbott says the record number of new cases is a result of more testing. New COVID-19 cases also rose by 68% in Oklahoma, where President Donald Trump plans to hold an indoor campaign rally on Saturday. More than 2 million persons have been infected with COVID-19 in the United States and 116,000 have died. A shortage of medical supplies in the South African nation of Peru is causing hospital workers to struggle in its life-saving efforts amid the COVID-19 pandemic. Many COVID-19 patients die every day there because the hospitals have run out of oxygen supplies. Reporter Dan Collins has the details.
Long lines for life's most vital element. Oxygen is in short supply for COVID-19 patients who are struggling to breathe. Shortages and price gouging have already cost lives in Peru's Amazon cities. But now there's also a lack of medicinal oxygen in the capital, Lima. Entering the 4th month of the pandemic and hospitals are running out of oxygen. People with sick relatives are having to make life or death decisions where to buy oxygen canisters in an open market where often the prices have been pushed up exorbitantly. Out of sheer desperation, many Peruvians have turned to the black market, often paying many times the normal price. People are lining up for hours, even days, to get the precious supply.
I work for a security company and I'm out all night. Look at the effort I have to make so I can help my mother. Because if she doesn't get oxygen in a day or 2, she could die.
But at this outlet, the price, around $5 per cubic meter of oxygen, has not changed since before the pandemic. And news spreads fast, says company manager Luis Alberto Balsayo.
When word got around that we were selling at $5 and we'd stayed at that price, overnight we woke up with a queue 5 blocks long. My God, what a commitment for us, but luckily we had enough for everyone.
People are grateful despite the wait.
We thank you, sir, for what you are doing. You are an angel.
Balsayo says they've never been busier.
We kept the price the same for the good of the population. Regrettably, others have raised theirs. In other words, they follow the law of supply and demand. But how can you do that when faced with such human misery? There's so many lives at stake due to a lack of oxygen. To charge more, that's just a terrible thing to do. But everyone must live with their actions and conscience.
Peru is battling one of Latin America's worst coronavirus outbreaks, as the pandemic has stripped bare its chronically underfunded healthcare. Earlier this month, President Martín Vizcarra said Peru would guarantee the oxygen supply. But for those caring for often elderly patients, it's a daily struggle to find the resources to keep them alive.
South Korean Unification Minister Kim Yeon-Chul has offered to resign. He's taking responsibility for the country's worsening relationship with the North and the recent blowing up of the office that was built to improve inter-Korean relationship. North Korean state media has accused the South of breaching and destroying recent 2018 agreements, including the Panmunjom Declaration, while the South says it remains open to talks. It calls the North's action senseless and damaging. Several brawls between Chinese and Indian forces in recent weeks have resulted in casualties on both sides. The latest conflict is a continuation of a long-running dispute between the two countries about the precise location of their Himalayan border. This has raised tensions between the two nuclear-armed rivals.
The Indian Army says an Indian officer and 2 soldiers were killed in a clash with Chinese troops at the border in the Galwan Valley region. And China says it has not received such a report, but added that India violated the consensus the two countries had reached.
On June 6, the two sides have reached a consensus on easing the situation in the border area. However, the Indian forces surprisingly violated the consensus, crossing the border twice to carry out illegal activities and provoke attacks on Chinese soldiers. This led to serious body conflicts between the border forces of both sides. We strongly condemned such practice and once again demanded that the Indian side strictly restrain the frontline troops in accordance with the consensus, and must not enter the line and take any unilateral sanctions that complicate the border situation.
In a statement, the spokesperson for China's Western Theater Command said the Galwan Valley region has always been Chinese territory, and India's action seriously violated the consensus and provoked the Chinese soldiers, causing violent clashes and casualties. It urged India to restrain its frontline forces, immediately stop all infringing and provocative actions, and to resolve differences through dialogue.
Up next, sport. Bayern Munich celebrates 8th consecutive Bundesliga title. Please stay with us.
You are watching ANN. Somewhere in the world, every second of the day, news is happening. And of course, Nigeria is bustling with news day and night. That is why ANN doesn't sleep. Our eyes are peeled, wide open, so no story escapes our radar. We stay abreast of world events and happenings at home. We keep you up to the minute in the world of sports. We give you information to stay on top of your investments and all the hard facts you'll need to navigate your day. If you miss us on air, you can keep up to date on our website and on our social media platforms, Twitter, Instagram and Facebook at ANN Africa TV. We are ANN, Africa News Network. We do news right in a truly African spirit.
Welcome back. This is ANN News in Sport. World 100 meters champion Christian Coleman has been suspended after missing a 3rd doping test. Coleman posted on social media that he would never use performance-enhancing supplements or drugs, and that he's willing to take a drug test every single day for the rest of his career to prove his innocence. The 24-year-old says he has been contacted by phone every time he had gotten tested. He claimed the Athletics Integrity Unit ARU tester wrote an incorrect address on his attempt form. The ARU says they don't call an athlete if it's not as a designated address. Bayern Munich celebrated an outstanding 8th successive Bundesliga title in a near-empty stadium. Bayern's 11th straight Bundesliga will put them 10 points clear of Borussia Dortmund, who have 3 games left. Bayern finished the match with 10 men after Alphonso Davies was sent off for 2 yellow card offences. That is ANN News this evening. Thank you for joining us. For details on these and other breaking stories, visit our website, annafrica.news. Conversation continues on our social media platforms, Twitter, Instagram, and Facebook at ANN Africa TV. I am Olajumoke Olatunji. Have a pleasant evening.